everybody, I'm Dr. Duc Vuong. I'm a world-famous bariatric surgeon, author of 13 books. Here is my degree, right here, Texas A&M University. There's my name, as you can tell, Doctor of Medicine. I put up my diploma because there are a lot of people out there who are, you got to make sure you get your information from the right people, all right? And I want to also show you guys, here's my certificate, my graduation diploma from when graduated Christus St. Joseph's Hospital here, general surgery residency, my name, my MD. This is 2005, all right? So there are my credentials. So I know what I'm talking about. I'm not a virologist or an epidemiologist, but I am a surgeon, and I've taken care of lots of patients in the past with ARDS, which is the process that coronavirus takes as you start to decompensate. So this is super important. I want to tell you how to protect your family, the best ways to keep this virus out of your house. So if that's important for you, please share this, please tag somebody, and please do it because it's the right thing to do, and it's very, very important, and I appreciate that. Thank you, guys. Today is March 26th, and the New York Times just reported that 75,000 cases of coronavirus in the United States with over 1,000 deaths now, which means that we've taken over second place over Italy. So we now officially have more cases in Italy. There's about 73,000 cases in Italy. The problem with Italy is they have a much higher death rate. So they have a 10% death rate. So they have 7,300 deaths. And US, we've been fortunate. We have a death rate of about 1.3%, but it's not zero. But depending on where you live, it could be very high. So Washington State has a 5 to 6% death rate. New York State, which is under attack right now. If New York State was a country with its over 30,000 cases, it would be number sixth in the world, New York State alone. So I expect the death toll to increase there in New York State. Now, I have friends who are surgeons in the medical field. They are reporting some really terrible news and data. The hospitals are full. ICU beds are getting full. They're making adding makeshift wards and ICUs, and those things are filling up right away. They're starting to send people home, even though you might have pneumonia. But as long as your oxygen saturation is up, they're trying to save a hospital bed for a day or two. So we're getting really darn serious here. And you're also going to start to see doctors are getting sick, doctors and nurses getting sick. So the information I'm going to tell you is what other doctors are doing, because you got to remember, God bless our medical care providers, our doctors, our nurses, because they're taking care of these very sick patients, and then they oftentimes will have to bring this home to their house and their families. So the information I'm about to tell you is what they're doing to keep themselves staying safe. All right, so after a shift in the hospital, and you got to admit, these are our healthcare providers are the ones at highest risk for contracting it. They're around, they're taking care of patients all the time. So this measure might seem extreme to you, but there's really no way around it. So when you pull up into your car, this is what doctors are doing, ER physicians doing. So when they leave their shift, when they leave their hospital, they're pulling up into their garages, okay? They are wiping down their hands in their garage with Perel. They are taking off their clothes in the garage, and hopefully their garage is next to I can touch my face because I just washed my hands, so I'm good. Hopefully you have your laundry room next to your garage, like a lot of houses do, and they put their clothes right away in the laundry room, and then they go take a shower right away. If you are living in a space where you don't have access to a garage, please don't. You can if you want to strip in the street, but the lesson being is that the second you get inside your house, you want to disrobe, and then you want to put pick up those clothes because you're still dirty, right? But pick up those clothes, put them in your washer and dryer, run the washer and dryer, wipe down your washer and dryer, and then go jump in the shower. Really lather up your whole body because you don't know that coronavirus is on your skin, anywhere else. We really want to really minimize this, okay? This exposure. Now, the physicians have taken some extreme actions. By that I mean if they're able to, they'll send their spouses and kids to stay with their in-laws or somewhere else so that they're not exposed. So sometimes these hospital workers, their families are getting split up, and that's really, really heartbreaking, right? But these are the times we live in, and God bless our healthcare workers. Now, sometimes for the medical techs, the lab techs, the nursing assistants, the nurses, they don't have that sort of resource where they can send their families away. Maybe they do, maybe they don't, I don't know. But these are the measures that that we know to tell you to do to keep the coronavirus out of your house. If you have visitors who come over, that's my daughter who's knocking on the door. Babe, I'm on. So, sorry, I'm working from home. So, so if you have visitors who are knocking on your door like that, you want them to go wash. Sorry about that, I had a call. Please share this video for me if it's helpful. Now, if you have visitors, and I understand, sometimes we can't go see grandma or grandpa, but sometimes you can't help it. If you have a visitor come in your house, first thing you want them to do is go right to the bathroom and wash their hands. Now, how are we washing our hands? We're not going to just, you know how Americans are, we barely get our hands wet, right? We want to wash our hands really well, and we're going to sing, right? Happy birthday to you. So let's say grandmother wants to come, and you can't stop her. She's coming, right? She wants to come see the newborn baby. Say, okay, grandmother, I love you, but we're going to go wash our hands, okay? So you wash your hands really good like this, and you sing happy birthday twice. So let's do it all with me. Happy birthday to you. Happy birthday to you. Happy birthday, dear new grandbaby. Happy birthday to you. Let's do it one more time. Happy birthday to you. And then you want to do this. Happy birthday to you. Get your knuckles. Happy birthday, dear, my little pumpkin munchkin. And this too. Happy birthday to you. And don't forget, back up here. In surgery, we also wash way up to our elbows, but I'm not saying you have to, but you really want to get your hands really nice and washed, okay? That's really the proper way to wash your hands. Disinfectant wipes are helpful. The different brands don't seem to matter. Lysol, Clorox, bleach, wipes, sprays, Windex, whatever you want to do. You kind of want to do that. Remember the doorknobs. Don't forget to wipe down your doorknobs, countertops. But if you just keep your house, where it should be in isolation, you should be good, right? If you're going out for groceries or whatever, I'd like to, if you're going to go out, have some wipes with you in your car so you can remember to wipe down your steering wheel, right? Because you were holding your steering wheel, your gear shift. Let me go get my baby. Hold on. Go. Baby, what?
I can't open.
Okay, let me open it for you. Where's your mommy? Why don't you ask your mommy? Here you go, baby.
Because it's the water.
Okay. Oh man, sorry about that. She wanted me to open her bottle of water. Isn't that sweet? All right. Okay, so where was I? Oh, in your car, you want to have some wipes for your steering wheel. Wipe down your shifter. Wipe down your door handles. Okay. Remember, this is contact. So the virus lives on surfaces, but it's also airborne. And remember, it's airborne for up to 6 feet, we believe. And it can last in the air for 3 hours, guys. It can be up in the air for 3 hours. So that's kind of weird. So there's just a lot about this virus we're not really sure, right? Now let's say, Lord forbid, you come down with flu-like symptoms. You come down with, so what are the symptoms, Dr. Vuong? Now, a lot of people are confused. They are saying, they think like this is like a mild case of the flu. This is, at best, the worst flu you've ever had. Just take the worst flu you've ever had and multiply it, right? So there's a good chance that you could be young, and by young, I mean under 60, so 45, 50 years old, and this could knock you down for 2 weeks, okay? If you start to have symptoms, and what are those symptoms? So what appears to be frequent is chills, body aches, especially back pain for whatever reason. Could be kidney or in that area, back pain, chills, a dry cough, usually a dry cough, not a wet cough. Fever's not as important, believe it or not. Sometimes low-grade fever, but the absence of a fever does not mean that you don't have it, okay? So you got to make sure. And then, here's a weird one. A loss of smell and taste. That seems to be very common. A loss of smell and taste. You guys writing these down? Someone write these down for me, okay? Most common presenting symptoms that we are seeing are dry cough, low-grade fever, chills, low body aches, especially low back pain, and loss of sense of smell and taste. That's a really weird one. If you have any of those stuff, and I know we on top of Corona, we have a regular flu season coming. We still have the regular flu season. So you could still be catching the regular flu, but just assume that you have coronavirus. So you need to really isolate. You need to really self-isolate in your bedroom. Hopefully there's a bathroom in there. If there's not, go out. You know, the only time you go out is to have a bathroom. Hopefully you have people bringing you your water, etc. You really should not be going out because you're definitely contagious. And you'll expose your friends and family. So sometimes if you're a single mom, you might have to ask people for help. You might have to send your kids to stay with an aunt or uncle. You might have to, if you don't have any of that, then you have to have extreme precautions, okay? Now, luckily, so far, knock on wood, this does not seem to really affect young kids. Yes, you hear the sporadic reports of the 16, 17-year-olds, but for some reason, we don't know why, young children don't catch this, and if they do, it's very mild for them. Okay? So if you do catch it, if you do have it at home, call your doctor. Obviously, let them know. Don't rush to the doctor's office. Tell them your symptoms, and they'll keep an eye on you for the most part. I guess the recommendation from the CDC at this time regarding ibuprofen, Advil, things like that, they're saying there's no clinical evidence that shows that ibuprofen or Advil has an adverse effect on this coronavirus. But due to anecdotal reports on the internet and stuff like that, they're recommending using Tylenol instead. So the truth of the matter with ibuprofen, Advil, we don't really have evidence of it yet. That's not to say there isn't, but just to be on the safe side, just take Tylenol. Stay hydrated. Hydration is super important for this, so just drink water. Anytime, Dr. Vuong, when should I really go to the doctor or whatever? At any point you ever feel nervous, don't take my advice. I'm not giving you medical advice, okay? I'm not your doctor. I'm this dude on Facebook, on the internet. What you want to do is anytime you're nervous or scared, go ahead and call your doctor, right? But I can tell you, if you start becoming like breathing is really a problem, you feel like it's pretty tough, you need to get your ass to the emergency room right away, not your doctor's office. Your doctor's office will send you right to the emergency room. So if you definitely have respiratory issues, like you're having trouble breathing, make sure you get to the emergency room as quickly as possible. Now, you guys are going to start seeing pop-up tents at your hospitals. They are going to be overwhelmed. Now, these pop-up tents, comment if you've already started seeing them in your area, town, or wherever it is you live. These pop-up tents are going to be coronavirus suspected patients, coronavirus triage, before they let you in the hospital. We know this for a fact, that we have to have a very separate coronavirus ward. We are seeing, even though these hospitals are creating new coronavirus wards, we are overrun in several of the hospitals with the cases. So this is going to be really ugly for a while, guys. And we need to stay strong together. We don't need to panic. We don't need to hoard toilet paper. But we need to really start taking this a lot more seriously. We need to take this a lot more seriously. Okay? Blessings, thoughts, much love and thanks and gratitude goes out to my fellow healthcare workers, and the doctors and the people in the front lines, the registration clerks, the nurses, the lab techs, the phlebotomists, the first responders, the ambulance drivers, paramedics. God bless them. Don't hoard their masks. Don't hoard their gloves. They need it. They're taking care of your patient, your family members, and they're putting their families at risk when they go home. So much love to them, much gratitude to them. Also much love and gratitude to the clerks in the grocery stores, the cashiers, the stockers, because they're out and getting exposed. Oh gosh, much love for our first responders, our police officers, our firefighters, because the coronavirus is a +1. Life has to go on. Other medical emergencies, heart attacks, strokes are still happening, cancer patients are still happening, car wrecks are still happening, and the coronavirus is a +1. Anybody who still thinks we're overreacting, give them a virtual bitch slap. They really deserve it. I mean, this is really, really serious. We today is March 26th. We've overtaken Italy in number of cases. Yes, we have fewer deaths, but remember the doubling rate appears to be 3 to 4 days, which means today's Thursday. By Sunday, we're going to have 150,000 cases by Sunday in the United States alone. And the world will be very close. We'll have about 900,000 cases to 1 million cases worldwide just by Sunday. Sunday, y'all. The 29th. All right. So I hope this video has been helpful. I didn't swear one time. So feel free to hit share now. Y'all good? Y'all good in the neighborhood? And I'll see you again tomorrow.